Now, this is a very well proven system. It's an evolution of many other systems, mainly from Germany. And in Germany, this kind of a system of medicine is well accepted and is used by medical doctors. You can analyze your patient's health very well using this system. Now, you must know from the outset, this is not a medical test, and it doesn't purport to be, and you mustn't present it as a medical test. But it's extremely useful for checking out the person in general terms, for checking their energy field, for finding out where their problems are really coming from. In its simplest form, you can just choose remedies for your friends and your relations. The machine itself is very simple to operate. There's a small sensor pad, and this is used to tune in to the person's energy field. This is a dowsing technique. It's along the lines of kinesiology, using a pendulum, using a divination rod, and so forth. But it's a particularly clever way of doing it, because it harnesses the minute changes, the idiomotor motions that happen in the human being when the brain is asking a question and you have a set-up signal that has been arranged between the brain and the person. So, for example, in this system, there are only two answers, yes or no. Now, what the yes means at any particular time depends on the question. You simply are pressing on the sensor pad, and when you ask a question, if the answer is yes, the pad will suddenly change in its energy content. What you feel like is as if you sink into the pad and you get a blip. Now, you have to train yourself to pick all of this up. In the meantime, you have a very impressive system for showing it to the patient. I relay my test onto a television screen, and at the end of the test, when you've gone through the system for the person, you have found their remedies, you can do a very professional report of findings for them, and this is produced then automatically by the software that goes with this system. On the screen in front of the patient, as we work, you see all the organs as they appear one by one. You're testing through, you're asking questions, and when the answer is yes, you get a blip. When the answer is no, you're still in your challenge mode, or you will not get a blip. In front of me, I have the test machine. I have a monitor, and then over to the left, I have the test set of remedies. So we're testing through the machine, we see it all happening on the screen, and we find the remedies over on the left-hand side. The first thing we find out about the person is the vitality level. You're measuring the immune system. Now, it's really the energy field that you're checking, the electromagnetic field. And this is a system that has been developed in Germany for many, many years. In this particular version of the system, 25 is the top of the scale, and you'll never see somebody coming in perfectly okay at 25. There's always some deficit. If the person, in fact, is over 20 on that scale, they're doing very well. Most of the people you will be dealing with will appear below the level of 20. When, of course, the person goes well below 20 and below 10, you're then into a state of depletion which will lead to clinical diseases and clinical ailments. But it's not your job to be doing clinical diagnosis or medical diagnosis. That's not what this system is for. This system is for checking out the energy field and finding the appropriate remedy using natural remedies, homeopathic remedies. There is also the facility on the face of the machine to do the vitality level manually. As you are going through your test, on the screen in front of the patient and in front of you are all these organs appearing one after the other. The question being asked in this series that you're looking at is, which is the worst stressed organ or the most damaged organ? When you reach the most damaged organ in this system, you'll get a blip. There are many factors which will appear in your test relating to the person, and you will need to know, for example, the degree of any particular factor. So if you find that the person is blocked on the emotional level, you're then in a position to find out what is the degree of blockage. You start at 0, is it 10, is it 20? You're pressing all the time on the sensor pad, and when you get to a level where there is a resonance with the patient, you get a blip, and that is the degree of blockage that they have. You then give the patient a prescription. This test set that we use is a very specific test set. The idea of it is to cover all the most frequent infections, poisons and viruses. The manufacturers of the remedies that we use more or less guarantee us that if we take the person through all of these remedies, there's no infection, poison or virus that we don't have some sort of remedy for, or some sort of antidote. Some of those antidotes are absolutely very powerful. A lot of the viruses are covered, so we treat a lot of chronic fatigue with great success. When the person has been tested by you using the machine, you will be able to give that person their exact prescription of remedies for that particular time. Now, when you knock out the top layer of infection that the person has, their immune system will start to heal them. And it doesn't matter really what the label is that's hanging on the person from a medical viewpoint. If you come in and help their immune system, you're going to see a good result. The remedies have been developed over 100 years, and many of the remedies we're using with the patients every day have been around for 100 years. They have not just been developed last week by the pharmaceutical company who has to keep all their whole mechanism going. There are many things that we look at. We look at the organs, we look at the systems, we look at the worst stressed organ, and we look at the dominant focus. The dominant focus on the day is where the person's immune system is at its busiest. We then make up the prescription, and the patient is usually taking the prescription for 3 or 4 weeks, after which you test the patient again, and there will be a new prescription and there will be new priorities. Our average number of visits is 4 visits, 4 or 5 visits, and our success rate in terms of satisfaction of the patients is 90 to 95%.